a joy that we have what I'd nearly say our residential dermatologist, Dr Justine Hextall. And we've got a subject we're going to discuss which is really close to many people's hearts who have teenagers,
yes.
Which is about teenage acne. There's nobody person than you speak to because you're so eloquent, and I've loved our conversations. And you'll notice Dr Justine sort of fairy dust around all of our T-zone. Why is it, and at what stage, because I feel the age bracket is changing, that we're getting in a way to see teenage acne so young?
It's really to do with change in hormones, and I think people are sort of seeing younger sort of individuals approaching with teenage acne, and it's really about change in hormones where you start to get these sort of androgens which drive oil in the skin, then oil in the skin block the pore, we then get the sort of comedones, and then you get the sort of pustules or papules, and that's your acne. So you get this inflammatory process once a pore is blocked with oil or sebum and skin cells.
And we've got the sort of housekeeping stuff which I think we can tick off, but I think it's more the internal and external. When it's active, very active, what one should also be doing, as opposed to when it's just under the surface and throbby and red.
So what should we do from an internal point of view of acne?
And with the idea of teenagers are not the easiest people to communicate with.
Yes, exactly. You know, we know that teenagers are going to drink sort of fizzy drinks, they're going to eat sort of food. Teenagers want something now, so they will tend to go for quick carbohydrate fixes, and I think we accept that. But I think the rest of the time, if we can encourage them to think about what they're putting on their plate and have a really varied, healthy diet, etc., with lots of sort of protein, sort of good vegetables, fruit, that's a good thing. So when they're feeling like it, try and encourage them that area. But I think it's important that we don't stop food groups. It's very important. Teenagers are growing, they need to have food groups, they need to have a balanced diet.
And there are these trends now which I know that, you know, as some other mothers have spoken to me, so there's been a TikTok run recently which is spots no dairy, and suddenly, you know, 8 of my daughter's friends were like, we mustn't have dairy. It's like really, some people, but how can we tell a teenager what to do, because they want to find it out from their peer group? Just convey when maybe a teenager says, oh, I've told I should never have dairy, and then that leads to potentially other food issues.
And I think that's a really important point, not creating food issues. And I think you'd say to your sort of child that there isn't a huge amount of evidence for that. There may be some slight evidence about semi-skimmed sort of dairy, which may be slightly pro-androgen, but on the whole, you know, we don't discourage teenagers, try not to make them sort of stop food groups. Basically, really, really important. So to say to them that having a balanced, healthy diet is incredibly important for our general well-being and of course for our skin.
So if you have a teenager, tell them, and if you did this, you could see a 50% reduction in this. You know, it's like the sort of factual thing. So when you look at what diet, in terms of eating healthy alkalizing foods, if you're, you know, androgen skin, prone to oiliness skin, what percentage could you have already just from that?
So I think that, you know, inflammation, so acne, it's an inflammatory skin process, and we need to remember that. So I would just say encourage a healthy diet, but explain to them that what they're doing to their skin is actually really important. And I think that when individuals see the first couple of spots, they start to think they're going to have to start this very strong skincare regime, and I think that's where the fundamental mistake starts. Really, in acne, you really want to have a calm, hydrated skin barrier. So actually, suddenly introducing lots and lots of actives, you know, several a day, is actually going to disrupt the skin barrier, promote inflammation, cause more redness, and may even drive the process. And it may upset what we call our microbiome, that natural sort of, you know, collection of, you know, important bacteria, yeast, etc. on our skin, which are there for healthy skin. So the first thing I would say is the most important thing is to go for a really gentle skincare regime, which is going to respect the skin barrier and keep the skin calm and hydrated. When I discuss that with patients, immediately they start to see some improvement.
And that's something that I think, so some teenagers, difficult to comprehend, because if you think my skin's bad, it's not getting better. If I do hardly anything and I have a very passive skincare ingredient, what am I putting in that can improve, make the pore cleaner? So you're not saying do inner skincare, because I think you need to look at those BHAs to help. But it's not like, are you going to do BH twice a day, morning and night? That's over killing the skin.
There is a sweet spot, okay? And I always use the analogy, when you have one chocolate, it tastes great. If you have 12 chocolates, actually you start to feel a little bit sick. You know, you may not feel so good.
That's
There's a law of diminishing.
Your skin is the same.
Yeah, your skin is exactly the same. So you're quite right. You want to try and unblock the pores. So things like azelaic acid, as you say, maybe sort of AHA, salicylic acid can really help to unblock the pore. But what you have to do is balance your actives with also hydration, because remember, an oily skin will still dehydrate and lose water, and you don't want that to happen. So it's important that not only are you using actives like your retinols, your benzyl peroxide, your azelaic acids, your AHAs, your BHAs in the context of acne, and they do work, but it's how you use them. And it's really about that, when to use it and how to balance the skin barrier health alongside treating your active acne. And the problem is that some of the prescriptions we give in acne, so when we prescribe prescription strength retinoids, or
like
things like
tretinoin,
which is quite drying, but it's very effective. The reason people stop using it is because the skin gets really dry and irritated, and they just throw it away and say it didn't work.
I do feel that for actives to work, it's really good to have that hydration in the skin. So are you drinking enough water, etc. But would you say then, are you looking, when you talk about moisturization, are you saying let's get some hyaluronic acid in there, which is more for sort of dehydrated skin, as opposed to let's put a skin barrier on the top?
So you have to be very careful about blocking pores. So you don't want to go for what we call comedogenic products. So
like an oil, because a lot of facial oils, to me, I don't feel have a great relationship with bad congested skin.
I agree with you. And then there seems to be trends saying if you put oil on the skin, you won't produce oil. I remember there was that trend at one point. It was just simply not true.
You must have had to have gone through so many trends that teenagers will tell you.
Pseudocreme on the face, you name it. And usually comes by my daughter, she keeps me up to date, But absolutely. So what you want to be using is putting things like your hyaluronic acids, your humectants, water-based products to really put lovely water-based hydration to the skin.
So things go in.
Absolutely. And that's really effective. And if you find that the skin becomes calm and hydrated, you will tolerate your retinoid then as well. So you'll start to have an effective treatment that you can comply with. The problem is, I can give as many prescriptions as I like, but if they're not tolerable, there's no compliance, it will never work.
Can we do spot picking?
Yes.
I'm going to suggest, so it's a tissue or it's a piece of paper. Will you just show close up the right and wrong way?
Okay, fine.
So imagine my spot is, just put anything on here.
Yes.
There's my spot. All right.
So first of all, I want to say that I don't feel at this point I want to advocate everyone keeps squeezing their spot. So I don't want Justine Hextall to be saying squeeze your spot. So you have to remember, when you do have a spot, it has to be ready to open up. So if it's deep and red and deeply inflammatory, keep pressing on the skin isn't going to work. It's going to potentially put the inflammation further into the skin. So you need to make sure that the pus is on the top and it's ready to
So when you say that, you've got that little white bit on the top. So those angry spots, which I had a lot, which never came somewhere, which I think can actually, if you use in anti-inflammatory ingredients, can make it go away before it comes up. And some of those big angry red ones never get to the surface. They're just those, that's what they are, isn't it?
That's right, yes.
What are they called, that kind of big angry red one?
Cysts, basically. Yeah, exactly. So you've got
but if you've got the top on, so I got the top on, the top is on here.
This is your little yellow pustule. Okay. So I'm going to wash my hands, make sure my hands are really clean, make sure I'm using something super clean, and then all I would do is literally press the skin so that you ease out really gently. So you can see I'm putting the pressure from side to side. I'm not pushing down into the skin, and I'm just going to release that top layer. What I'm not going to do is keep doing it until we get blood and then something deeper, etc., into the skin. You're not looking to do that. You're just literally looking to do the top surface. If you keep pressing,
I thought you should wait until you get the blood and then the last bit of pus. So it was like my mantra. I was addicted to it, Justine. I'm so interested to understand why I'm going to stop at that top bit of pus before blood comes, because if blood comes, it's inflamed.
Well, all you're doing is if you keep pressing and pressing, you're going to push that inflammation deep into the skin. And if you get the inflammation deep into the dermis where we produce scarring, then that's going to increase your risk of scarring, which we don't want.
It's really difficult with a teenager to help them to understand scarring, because I had very, very bad scarring from picking and not having that knowledge to not pick. As an older woman, I'm going to go really close to show you the damage you cause when you pick your skin, because I have separated skin here. As I go down the path of life, skin separates anyway, but when you've had a lot of acne and you've been picking a lot the same place, you'll get more separation.
Yes.
So just many reasons not to.
Many reasons not to. And I think the point I'd also make is, mild and moderate acne can cause scarring. So, it's not just like really severe, sort of, deep cystic acne. So if there's a chronic acne which isn't being treated, then, that is also at risk of scarring. And so it's important to get the acne under control. Also is people get very tempted to treat scarring before they've treated the acne. There is no point in treating acne scarring until the acne is under control. Just save your money, and just wait and get the acne under control. And you can do wonders with topical treatments, that's my view, but what skincare you're using alongside that treatment is really important. What someone's using day in, day out will dictate their skin health.
Now, when you get to a stage where you feel that your skin is not benefiting from what you're doing, I think there are some teenagers who very quickly go down the route of Rectin. When do you look at a skin and think they need to go from a topical solution to a antibiotic or something like
Yes.
Rectin?
If I'm concerned about scarring, and I feel we've had a really good run out of the treatments, okay? So people that know me, come and see me, know that the first thing I'll do is take a really good history and find out what they've actually used to date.
Yeah.
And it's very interesting. People dismiss topical treatment for acne. You know, they dismiss it. You know, it's very interesting. They even say the words. I say, "What have you had for acne?" They say, "I've had this antibiotic and that antibiotic, and I've had another antibiotic. Oh, and some topicals." But actually, if you look at the NICE guidance, the National Institute of Clinical Excellence guidance this year, it talks very much about topical treatments in, you know, moderately severe acne. So it does work very well. A combination of a retinoid or benzyl peroxide I like to use in combination with something like azelaic acid, I get some really good results. But it's really how you use it. It's difficult to tolerate, and it's about making sure the skincare supports that prescription. So I would definitely start with that if I can, and then I may consider an antibiotic. I'm not mad about long courses of antibiotics.
Like oxytetracycline or minicin or things like that.
You know, and I think, you know, as doctors, we definitely need to be sort of trying to sort of, you know, lessen how many antibiotics we're giving, but also there's not a lot of evidence for using it for long term either. So you want to start preferably at a lower dose, and then you want to have an exit strategy, so where you're going to come off the antibiotics and use it in conjunction with your topical treatments. And then if that's not working, and we know that we you know, sometimes I will also do things like some mandelic peels and LED lights, some physical therapies as well. But at that point, if we're not getting control, then of course we would consider isotretinoin. But it's very interesting, in the last 2 years during the pandemic, there's been concern about the nose getting dry with isotretinoin, because obviously mucous membranes dry out. And that's an important point of our immunity against COVID. So we've been told as dermatologists to counsel that and consider that. So interestingly,
in terms of catching and how much you've got in your nose to protect you.
That's right. So we were all told that, you know, we had to discuss this. And interestingly, many of us have been using topicals and antibiotics very successfully. Maybe in cases that there might be more of a knee-jerk reaction to give isotretinoin. So if you are going to give isotretinoin, you have to choose your patient very carefully. You know, we always do get concerned about changes in mood. It is something we are, you know, you should be concerned about.
In boys more than girls or not?
Both. You know,
no, it's equal. There isn't medical evidence to show it's slightly more in boys.
So slightly more in boys, but like, you know, I wouldn't sort of differentiate. I would just take a very careful history. And, you know, you have to discuss with them the lowering of mood, that they have to go off medication. You need to have a very close conversation with them. They know how to get hold of you. So we do use it, and it is successful, but it's about choosing your cases very carefully and also making sure that you really have had a good go at further treatments before starting it. That's my view.
Good. So much information from Dr. Justine, and I really hope that's helped you if you're a teenager watching, or as a concerned parent who's thinking, how can I help my teenage child to go on this journey so they come out the other side feeling that was just a phase that didn't last, in my case, 17 years. Thank you so much for coming on, and catch up again soon. Bye.
Thank you. Bye.